Friends, in the before video we discussed about activity 1. Now we will discuss about activity 2. Activity 2 is nothing but some similar with activity 1. First of all, what is the aim of the activity 2? To prepare a matchstick stethoscope. It is not funny. It's real. A matchstick stethoscope. And the materials required is matchstick and one shut button, one unused shut button. Okay, I will not write the procedure points, I will say with words, you must note down. First, the procedure, first the point 1 is take a unused shut button which is not useful now, or any shut button you want means. And second point is now take one matchstick, matchstick, and point 3 is insert that matchstick to the one of the hole of the shut button. So there are holes present in the shut button, keep a matchstick on the holes. The fourth point is take our wrist of the hand, one hand, keep the apparatus, what we done in three steps, keep the apparatus on the wrist of the hand. And fifth point is observe the rhythms and observe the movements on the apparatus we kept. And the observation is we observed that the apparatus which we kept is moving up and down, moving rhythmically up and down. What is the reason of moving this rhythmical up and down? Because of this pulse rate is showing our pulse rate. Calculate per 1 minute, it will show our pulse rate. What is meant by pulse rate? So when we keep our index and middle fingers on our wrist, it shows the movements of rhythmical up and down, and it is calculated per minute, is called pulse rate. Okay, and there are also some questions in our activity. What is the activity shows? And activity shows what observation we did. It moves rhythmically up and down. This is called pulse rate. And in which situations pulse rate is more? It is asked one question actually. So pulse rate is more when we shocked or when we excited more. When you are afraid or excited or shocked, our pulse rate increases because our heartbeat also increases. When we see a horror film, when we see a horror movie or we see a devil in the horror movie, our heartbeat increases. We feel very excited and we feel very shocked, and our heartbeat also increases. As I said, that pulse rate is caused by heartbeat. When heartbeat is increases, our pulse rate also actually increases. Okay. And also one more question, and what does this pulse rate shows? As I said now, the pulse rate shows that how many times our heart beats, and it shows a blood circulation also. Okay, this is activity 2. Now let us discuss the next step. And also this pulse rate, and now we will see about how the pulse rate is differentiated in different ages. Okay. Okay, now see how the heartbeat is differentiated in different ages. At newborn babies, our heartbeat, at a newborn babies, this is actually in our textbook. Do you know one table is there? Let us check that table for the. Let us please make sure that you have a textbook in your hands while listening this video. If you have no textbook, it is not well understood for you. Okay, please check your textbook and listen. And the newborn babies means 0 to 3 months. At the age of 0 to 3 months, the heartbeat is 100 to 150 per minute. So in the newborn babies, the heartbeat is 100 to 150 per minute. And now in the infants means also children, 3 to 6 months. Infants 3 to 6 months, the heartbeat is differentiated as 90 to 120 per minute. This is some less when we compare to newborn babies. And also infants, again infants 6 to 12 months this time. It is defined as 80 to 120 per minute. Okay, 80 to 120. This is a normal heartbeat in different ages. Okay, and also 1 to 10 years. At children 1 to 10 years, this is 70 to 130. 70 to 130. This is some range will increase when compared to infants at 6 to 10. But now when we compare about 10 years, about 10 years means all our adult and senior citizens will again come down 60 to 100. This is a normal heartbeat in different ages. When we again come to well trained athletes, means well trained athletes are different from normal human beings, right? They will strain more, or they will run more, they will exercise more. The well trained athletes, it is up to only just 40 to 60 per minute. Just 40 to 60. So why this very less? Why this heartbeat is very less in well trained athletes? Because they have the ability to utilize the other body parts more. So they are utilizing more legs, more hands. They are utilizing the remaining body parts more. So the heartbeat also very less. Again, in one situation, while they are running, so they will stop breathing. While they are running, they will control the breathing, because to run very fast. That's why while we will discuss this in second chapter, respiration, I think. When they stop breathing, anaerobic respiration happens in the legs. Lactic acid is produces. It's also a small reason about this. This is the different heartbeats in different ages. Now let us just move into next further topic. Now discuss about what is the instrument used to measure the heartbeat. It is very all will know what is the instrument is. This is nothing but stethoscope. And this is the instrument called stethoscope. And who discovered now stethoscope? And let's talk about some history about stethoscope. Who discovered this stethoscope? So stethoscope was discovered by Rane and Lennack. Okay. So Rane and Lennack was discovered stethoscope. And how he discovered stethoscope means he taken a paper tube. He make a paper as a tube and check the heartbeat and listen heartbeat. And after he tried with a bamboo stick also, and he named as a stethoscope. That is a small story about this stethoscope. Okay, now let us see the further topic. Now let us discuss about activity 3. The activity 3 is nothing but a very simple activity. I just explained with few words. So activity 3 is nothing but, so you will also make a tube, a paper tube like Rene Lennack did, and so some of the friends, so go to some of the friends, your friends also will do the same apparatus and check the heartbeat of your friends and the pulse rate of your friends with this tube, 10 centimeters long tube. Okay, check the heartbeat and pulse rate of some of your friends and list out a table. You will notice that both heartbeat and pulse rate are equal. Why? Because pulse rate is caused by heartbeat. This is the reason. And this is activity 3, which is a simple activity. Okay, now let us discuss about heart. So very very important organ in the blood circulatory system. Heart, blood vessels and blood, these are some, but heart is the very important organ because it pumps the blood to all the organisms. So heart is when heart stops beating, we will die. And heart is the main important organ in the transportation or even human body also. Okay, heart. Now we will discuss about heart. Heart is a conical or pear shaped organ. So conical or pear shaped. Heart is a conical or pear-shaped organ. So what is the weight of heart? The weight of heart is around 300 grams. Okay. The weight of heart is 300 grams, and is the volume. This volume of heart is the volume of the shape. The shape of the heart is compared to our shape of the fist. Pedically we call shape of the fist. Okay, the heart it resembles the shape like a fist of our hand. Okay, okay, and the heart in the heartbeat is produced by two stages: contraction and relaxation. When we inhale, our heart contracts, means the volume is decreases. Our volume is decreases, and this contraction of heart is called systole. So before discussing about contraction and relaxation, heart is located between the lungs and protected by rib cage from all the sides. It is present between the lungs and present in the chest cavity. Okay, heart is present between the lungs in chest cavity. And let's discuss our topic. The contraction of heart is called systole. Is called systole. Okay, the contraction of heart is called systole, and the relaxation of heart, when we exhale, our heart relaxes, means volume increases and pressure decreases. This relaxation of heart is called diastole. This relaxation of heart is called diastole. And while in the contraction of heart, the blood pumping is more, because while we are exhaling, is the volume of chest cavity increases. Okay, the volume of chest cavity increases and the blood pumping also more. Okay, while in the relaxation of heart, the blood pumping also is very less compared to a contraction. This is about this we will discuss in the middle of the topic about contraction and relaxation, about arteries and some more, so many organs. Yes, this is our today's topic, and let us now discuss about the internal structure of the heart in the next video. Okay, thanks for watching, and please like our video if you like, and please subscribe our channel. Thank you.